So, like a lot of you, I have been glued to the Lindsay Clancy case and I've been watching it unfold in real time. And the more that I've watched, the more frustrated I've gotten with just how fragmented our medical systems actually are in this country. So I kept running it through my head and coming back to the same question, like what could we actually do differently to reduce the likelihood of another tragedy like this ever happening again? And listen, I get it. Like, I'm a realist. I know that bad things are still going to happen no matter what. And unfortunately, that is the history of humanity. We're never going to be able to build a perfect system that protects everyone and predicts every person's behavior or prevents every tragedy from ever happening. But for me, I think that is a cop-out. I mean, I get the phrase, we can't fix everything, but I don't think that's a good enough reason to not make at least an attempt at trying to fix something. Hi, I'm Veronica. I'm a licensed therapist, and a little while back, I made a video breaking down the Lindsay Clancy case and the trial. So if you are not familiar, I'd recommend watching that, and I'll put a link description below in case you wanted to check it out. But honestly, the entire time that I made that video, I was really upset. Like, my heart goes out to that family, especially those kids, and everyone who's ever loved those kids are now going to have to live the rest of their lives without them. And I don't think that justice is ever going to feel like enough in that situation. And so that's part of the reason why I haven't been able to let this go, because eventually we're going to get a verdict. The news cycle is going to move on, and another headline is just going to swallow this one up, and then what? Nothing changes. So the world's going to keep spinning, and that's that. And something about myself I've noticed is that my brain tends to hyperfixate on things, and like I can't let it go. And so now I'm kind of sitting with, how do I fix this? How do we all fix this? And in this particular case, like we can't go back in time. No one can go and change and undo everything that has happened to this family, but we can only talk about what we can do moving forward. So this video isn't about what happened at the trial. This is more of a video of if I had a magic wand and wanted to start changing some parts of the system that are already established, what I would do. And honestly, in my opinion, I think it needs a complete rehaul and needs to be rebuilt from scratch, but I don't foresee that happening anytime either. So this is kind of just like some crazy ideas that I had. Some cynical part of me really thinks that making this video is kind of pointless, because I think it's just going to go out into the void and nothing's going to change. I mean, this country is really focused on like making money, insurance, politics, all these systems are really basically built to resist change, generally speaking. But you know what? I don't care. Making this video is, like, in a way, partly out of spite for a system that profits on people's pain, and partly because I think that if enough people keep talking about this, eventually, if we can keep the pressure on, who knows, maybe something can eventually shift. Because when I look at this case, I don't see just one tragedy. I see a bunch of smaller systems, problems, and failures stacking up behind each other. I mean, like bad communication, no coordination between providers, limited parental leave, like that are just provided to workers, just to name a few. And genuinely, I think a lot of these things are fixable, probably not overnight, not perfectly, but fixable in the long run. One thing that I really want to be upfront about before I get into my list is that fixing some of these problems the way that I am talking about would probably create more problems, because that's just how systems work. It's not a one and done kind of thing. Whatever changes happen would probably need to continue to evolve so that we can figure out like what works and what doesn't work. So keep that in mind. Like, these are not perfect fixes by any means. Also, just because I'm a licensed therapist doesn't mean that I'm your licensed therapist. This is educational content, discussion only, not therapy or advice. So if you're in an emergency, call 911. And if you're having a mental crisis situation and you're in the US, call or text 988. And if you got a better idea than mine, or you've navigated this medical system yourself as a patient or a family member or a provider, and you have a thought that you want to share, drop that below in the comments. Like, I don't have all the answers, but I'm always open to hearing better ones, So to me, one voice alone doesn't do much, but together, if we actually push towards something, that's where the magic happens. So where would I start with this broken system? So first things first, I think that somebody actually has to own the coordination of care. And if someone is seriously struggling and they have a psychiatrist or a medication management specialist, a therapist, an OB, a PCP, an LMNOP, like And maybe even a hospital stay sprinkled in somewhere. They're like, all these people have different pieces to the picture and no one is able to see the whole thing. And so right now, coordinating all of that clearly isn't anybody's job. So let's make it somebody's job. So in order for this to happen, I actually think like two things need to take place. First, some kind of secure shared system needs to be created where if something significant happens, a provider can flag it once and then the appropriate people that are on that person's care team can get notified. Maybe it's literally a secure database or form online that a provider can fill out where it's like, hey, something significant has changed, follow up with patient. It doesn't need to include their entire therapy record or all their private details, but just what people actually need to know, like recent suicide attempt, currently receiving inpatient care here. Significant change in mental health, follow-up needed, because having a primary care doctor or a therapist manually call 5 different providers every time something happens isn't realistic either. That's creating another impossible job where people can fall through the cracks. So right now, even when a client gives permission for a person to coordinate with another provider, it still doesn't mean that the coordination or the communication is actually happening. Some providers are amazing, like they get back to me right away, they're awesome, and other providers are trash. Like you might email them and email them and email them and wait and call and like do smoke signals, and no matter how many times you try, you may never hear back. Eventually it's like, oh well, there's nothing you can do about it, so what are you gonna do? And I get it, maybe that provider's busy or they're overwhelmed or they have an insane caseload. And a lot of this coordination work isn't separately reimbursed by insurance, so it's largely unpaid. So providers are doing it on top of everything else for all their clients. So maybe insurance companies need to fix that too, because it is work and it takes time. Bloodsuckers, something in my throat. Whatever the reason may be, there needs to be some kind of incentive for like the actual time that's built in to do this work. Either way, whatever excuse or reason, like that doesn't change that this is a problem for the patient, and it should be something that we as like a system, as a community, as a people start addressing, because this is another area that's like needs to be fixed. The second thing that I would change is that whenever someone is starting or stopping like a new psychiatric medication, someone else needs to be involved in their care that actually knows what they're normally like. Quick story, a close friend of mine told me that their first appointment with a psychiatrist was like 45 minutes, and then their other sessions afterwards and follow-ups were closer to 15 minutes, and they felt really rushed. They also told me that one of the appointments was marked down as like a 60-minute psychiatric session, even though it only lasted like, from what she told me, 15 minutes. Now, like, I didn't see the bill myself and I wasn't there for a session, so I'm like not making any claims about what happened there, but it really did make me stop and think, like, if you're only seeing this person for 15 minutes and you met them like what, once or twice, how do you actually know them or even know what their baseline is like? And look, maybe 15 minutes is completely fine for someone who has been stable or on the same medication for 5 years and had the same provider for an extended period of time, and maybe this is like a quick check-in. But when you're like a new client, like a legit brand new person, like this provider, has met you one time? How are they supposed to know if something changed if they barely even know what your normal looks like? That's where I think like therapists, family, and friends are really valuable in that situation. Like I'm a counselor, I don't do medication management for people, but I do work with my clients, and some of them I see every week. So if they're suddenly sleeping too much, or they're agitated, or maybe they're speaking fast, or they just seem off, like not themselves, there's a good chance that I'm gonna notice that and be able to have a conversation. On the other hand, like a spouse or a parent like will probably notice this even sooner. And sometimes the patient genuinely doesn't realize just how big of a difference they're acting because they're experiencing it from inside their own perspective and in their own brain. And I also think that families need to know that they can speak up too. Like people hear the word HIPAA and then they think like, well, I guess the therapist can't talk to me, so I'm not going to talk to the therapist. And that's not the same thing. Like I can't tell you what someone says in therapy because that's confidential, and I can't even confirm that they're my client. But if a husband calls me and reaches out and says like, hey, she hasn't slept in 4 days and she's acting different and I'm scared, I can listen. I might not be able to tell him anything back, but I'm absolutely going to be taking note of what he's saying and maybe even giving him regular community resources that I would give anyone. Maybe we need to make that much clearer to families, because sometimes the person that knows you best is going to notice this change before even the person experiencing it does. And there shouldn't be like a barrier to get help. Like, community resources just should be a given. And even if a stranger calls you on the phone, you being able to route them to the appropriate areas of like, hey, here's the crisis 9. Hey, here's the emergency number. Hey, here's a facility. That can be a big help to anyone. Another thing that I would change is that we would all have like one consistent baseline for responding to psychiatric emergencies. Like right now, we already have like a lot of screening and assessment tools like the SAFE-T, the CSSRS, and the ASQ. And I'm not saying that we really need to reinvent everything. I just think it needs to be taking what already exists and then streamlining it and turning it into like an actual system that people use instead of it being scattered all over the place, and making sure that providers actually know how to use it. Making those trainings free and easy to access and require those refreshers every few years. Like obviously state laws are going to be differing and different professions are going to require different levels of training, but like the basics shouldn't be completely different depending on where you work. If someone is in a psychiatric crisis, like providers should at least be working from some basic foundation. The next thing I would change is what we actually test providers on with their board exams before they're allowed to practice, because some of it makes no sense. Why are people sitting for a board exam and getting quizzed on what year some old fart invented a concept? Or like what year a screener was developed? Like, you. Anyone can Google that. Why is it that we're using those types of questions to decide whether someone is ready to work with actual clients? Like, these exams should be way more focused on the things that actually matter when someone's life is on the line. Direct client care, risk assessment, suicide assessment, how to have a hard conversation with someone when they just told you something terrifying. You know, like, what do you do next in this situation? When do you escalate care? You know, like that should be the bulk of what we're testing people on, and not some random trivia bull crap from the history of the field. I'm sorry. It just doesn't make sense. And once again, I come right back to the same disconnect. We train and we test people on the wrong things, and then we act surprised when somebody freezes or they miss something in an actual crisis. Like, if we're going to create better national standards and higher expectations and trainings that providers need to have, then we need the gatekeeping exams that let people into these fields actually reflect that level of competency too. Next part I wanted to go over is that as providers, we need to find ways to build trust so that people feel comfortable sharing the scary stuff that they're experiencing. People need to understand that just because you have a scary or intrusive thought doesn't automatically mean that you're going to act on it or that you want to act on it. I think a lot of people are afraid to say some of this stuff out loud because they're afraid that they're going to have their baby taken away, or that they're going to be involuntarily committed somewhere, because that's just what they've seen on TV and in movies. But if someone says like, hey, I had this horrible thought and it scared me, like that actually gives the provider more information, because now we can ask questions like, what's actually happening here? And how can we figure out how to give this person what they actually need to support them through this? Because a lot of times, like, people, like, what they're seeing is not necessarily intent, like it's actually fear. Someone with a history of sexual trauma might avoid certain caregiving situations because something from their past is being triggered and they're scared and they don't want to repeat anything. Someone with OCD might have repetitive, unwanted thoughts that are deeply disturbing to them, and they become so afraid of those thoughts that they start avoiding tasks altogether. Like, in both those situations, that doesn't mean that we ignore the behavior or the situation. It just means that we have to understand like what's actually going on behind the scenes so we can address the concern and keep everyone safe. Because avoiding responsibilities creates risk too. And that's really my point here. Every situation is different. If someone is experiencing symptoms that indicate that an immediate safety concern is present, that needs to be taken seriously and assessed appropriately. But we can't, as providers, make that distinction if people are too afraid to tell us what is actually happening and what they're experiencing. People need to have a safe space to say, hey, this is what's going through my head, without immediately feeling like they're going to be punished for being honest. Because if people are afraid to tell other people the scary stuff that they're experiencing and they just stay quiet about it, well, that's not exactly what keeps people safe. The goal should be to make it safer for people to be honest so that we can actually figure out what they need and support them. The next thing I would probably change is the approach on how people do screening. Most doctors' offices are pretty good at handing out like regular screening tools. You know the one, like the depression questionnaire or assessing anxiety and suicide. Everyone gets them like when they sit down in an office. And then what? A positive screen isn't a solution by itself. It's information, but someone actually has to follow up and take the next steps. Giving someone like, hey, here's a list of providers, good luck, that's not necessarily like a great plan because many providers on that list are already booked up or they're not taking new clients. So you've already set them up for failure. When I can, what I personally like to do is what is called a warm handoff. And that's basically where I loop the next provider in before someone leaves my care. Now, it's not mandatory, but I found that it makes the transition a lot smoother for my clients. Even if they start seeing like a psychiatrist, I think it just is helpful. And I think that we need to take that same mindset when someone's discharged from a hospital. Discharge should be the start of the next phase, not the end of the story where you just send them off and forget about it. Being stable enough to go home doesn't necessarily mean that the crisis is over. Like there should still be real effort to supporting people and making sure they actually have follow-up appointments scheduled so that they know what they're going to do next. And I see that a lot of times that doesn't happen. And honestly, that leads me to my next point, which is like there's a bigger issue under all of that, and this is money. Like insurance coverage can affect how long someone is able to stay at a certain level of care, even when a doctor or someone might say otherwise. A doctor can recommend one thing and one level of care, while an insurance company may approve and pay for something else entirely. And that's another piece that needs to change. I mean, someone please explain to me tell me why a provider's clinical judgment and recommendations don't carry more weight when it comes to someone's care. Someone make it make sense, please. The provider is the one that's actually sitting across from that client. They're the ones that are assessing them. They're seeing the warning signs. They're determining what level of care that they feel that the client needs. And then the insurance company that's not even in the room, they don't really know this person. They are the ones that can decide what is covered, and they do it based off of the plan. And that can really affect a client too, because if the care a provider recommends isn't covered, or that client is left with a huge bill, then that can become a barrier to them getting the help that they need. Realistically, if someone can't afford it, they're not going to probably take the steps and go for it. On top of that, if something goes wrong, then the providers are the ones that are held liable and not the insurance companies. This doesn't make any sense. Are you kidding me? I don't even get me started. Something I touched on earlier in the video that I just want to reemphasize is giving families more support on how to handle things. A partner can't notice something if nothing's wrong and no one told them what to look for. And I've also seen people jump into denial of oh yeah, he's fine, he's okay, or she's fine and she's good, she's pushing through it. We're powering through. So if we give partners, family members, parents, siblings actual warning signs, and we give them a number to call when things go wrong, and we tell them, hey, this is when to escalate, they're probably going to have better outcomes with that too. You can't expect someone to know how to do all this stuff when they're already exhausted, they're overwhelmed, and they're trying to keep everything together. It's just, they're not going to catch the warning signs right away if they don't know what to look for. And honestly, I think what people need most isn't another therapy appointment. It's sleep, it's food, and it's someone to hold the baby for an hour and someone to help with the kids. It's literally community. And the more we can give access to those resources, the better it can be. Nowadays, there are so many people that are isolated, trying to manage everything inside their own homes by themselves. And no wonder they're depressed. It adds so much more complication, and it just exacerbates symptoms to just not have support. And that's also part of why I think longer paid parental leave matters, because recovering from birth and adjusting to a completely new lifestyle takes time. It takes support. And right now, our leave policies just don't account for that. And people don't always have family backing to be able to add those additional supports in. So this isn't a radical idea. Other countries are doing it. Some places have up to a year of leave. We, as United States, are just not there yet. And honestly, I think that's a bigger problem too. So much of this country is built around productivity and the bottom line that it's leaving people completely burnt out and falling apart. And now we're seeing the side effects everywhere, including in our mental health as an entire country. So yeah, all in all, I think we need more layers built into the system, because you can't build it all based off of one clinician perfectly predicting everything, especially if they don't see the person all that often. But if we have more of a team framework built in, I think it could definitely help in the grand scheme of things. So in closing, I'll be completely honest, even if we did every single one of these changes tomorrow, bad things would probably still happen. In an attempt to fix pieces of a broken system, this is going to resurface new problems that we just simply haven't thought of yet. And that's normal. That is literally how change works. And at the end of the day, we can't undo what has happened, but I really think that we shouldn't go back to the way that things were either, because that's just how they've always been. Something needs to change. We need to do better. We need to evolve so that fewer people slip through the cracks, because so many already have. We're just hearing about this particular case because of how gruesome that it was, and that there were kids involved, and it's a public trial. And understandably, that gets attention in the news. But there are so many other people that have been lost to suicide after falling through gaps in the system just like this, and their stories don't always make the headlines and they don't pop up in the news. But that doesn't mean that they don't exist. It shouldn't take a tragedy involving children for us to recognize that the system is broken and it should be better. So thanks again for watching. Drop any ideas that you have in the comments below, and please remember to like this video, share it with someone in power that might need to hear it, and subscribe to the channel for more videos like this. Thanks again for watching, and I'll see you in my next video. Bye.